Medical revalidation of Puerto Rico, clinical vignette on case control study. Clinical vignette. A group of researchers is investigating a potential association between smoking and lung cancer. They identify 200 patients who have been recently diagnosed with lung cancer and 200 individuals without lung cancer from the same hospital. They then ask both groups about their smoking history to determine if there is a relationship between smoking and lung cancer. Question: what type of study design is being used in this research? A. Cohort study. B. Cross-sectional study. C. Case control study. D. Randomized controlled trial. Correct answer C. Case control study. Explanation: case control studies are retrospective and compare patients with a disease cases to those without it, controls, to identify past exposures, e.g., smoking history. These studies calculate the odds ratio to measure association. This design is efficient for rare diseases and quick but prone to recall bias. Why not the other options? A. Cohort study follows exposed versus non-exposed individuals over time to see who develops the disease, prospective or retrospective. B. Cross-sectional study examines exposure and disease at a single point in time, not past exposure. D. Randomized controlled trial, RCT, involves intervention, e.g., assigning people to smoking versus non-smoking groups. Key features of a case control study. Feature: case control study. Study type: observational, retrospective. Groups compared: cases, disease versus controls, no disease. Starts with outcome, looks for exposure. Measure of association odds ratio. Strengths: good for rare diseases, quick, inexpensive. Weaknesses: recall bias, cannot establish causation.